Saturday morning, the Experts program kicks off here on Power Talk Radio, 1460 and 101 FM. Luis Alvarez, CEO of the Alvarez Technology Group, joining us right now. Good morning, Luis.
Good morning, Mark. How are you?
Doing pretty good. Beautiful weekend that we have. It looks like we're into spring now, and we're getting some of that really nice spring weather that we're so famous for.
Yeah, I'm looking forward to it, getting out on the boat a little bit more, as we had some inclement weather here the last few weeks that made boating not so much fun, but it looks like we're going to get into a stretch here that's going to make it a lot more pleasant out there.
That's right. Knock on wood. Yeah. Say, CBS News has a story about Amazon getting into healthcare services. They're going to market a telemedicine app. So what are they up to?
Well, Amazon has always been at the forefront of turning what is typically a cost center into a profit center. So if you look at for example, Amazon Web Services, that's their hosting service that allows you to use their data centers to host your sites. That originally was a cost center. It's something they developed for their use internally, and they realized, hey, this is something we can make money on. And their second most expensive line item in terms of cost, because they're such a huge company, is healthcare. So they've developed internally a lot of technology to minimize their healthcare costs. And now they're making that technology, especially their telemedicine program, available to other employers starting in Washington State where they're based. But eventually they want to take this out nationally so that any company that wants a contract with Amazon will be able to offer this as a benefit to their employees. And telemedicine has made such huge inroads during the last year because of the pandemic and people not wanting to go to doctor's offices. So people are much more comfortable with the idea of using an app and being able to call a doctor online and explain your symptoms and show them, whatever scars you happen to have and have them prescribe whatever medicines you need. And then Amazon will deliver those prescriptions to you the next day. Right. So it's kind of this whole closed loop thing that Amazon is going to make available to other employers. And it's scaring the daylights out of traditional insurance companies because they're going to have to compete in a way that they're not really equipped to do.
And I think there's a lot of big profitability for them in the status quo. So they're probably looking at this really impacting their bottom line if it really comes to fruition. I know some doctors' offices are using a program called MyChart that also has a video and audio element to it so that you can have video chat with your doctor. I've had several appointments with doctors over the last year done that way, where all they need to do is just go over test results with you and they don't actually have to put their hands on your body and do anything like that. So it does save you some time and so forth. And really kind of the negative about going and sitting in a doctor's office is if there are people that are sick in there, and every time I go into the doctor's office, it always seems that there's a couple people that they have to come and sit right down next to you and they're hacking up a lung. And you're thinking to yourself, oh, great, this is all I need. This idiot's going to make me sick. So it is, I kind of like this. I kind of like this new trend towards telemedicine. I just wish that you'd get a discount on the doctor's visit price for not actually physically being there, because I did notice when I got the bill that you get charged the same, whether it's a telemedicine visit or it's an in-person visit.
Yeah, and that is something that eventually I think a company like Amazon will be able to help drive down costs, because they're not going to approach it from the traditional way of doing business. And like you, I really enjoy the fact that telemedicine lets you contact a healthcare professional 7/24. You don't have to worry about, I need to make an appointment, and you call and the doctor can't see you for 3 weeks because they're busy and they have patients stacked up. This way you can just connect up with your app and you're online talking to somebody and within 5 or 10 minutes.
And it usually takes 60 seconds or less to connect users to a healthcare professional that can answer a question for them, or at least look into what it is that they are querying about.
Yeah, and this is also good for those healthcare professionals because this gives them an option. They may not necessarily want to work in a traditional healthcare facility because maybe they have kids and they want to work from home, or they have a desire to not have to drive someplace. Well, they can work from their house. Right. They can just be on call, if you will, and they get connected to a patient that's looking for help without having to go into the office.
We also see that demand for virtual care is rising. So, for example, I'm looking farther down the story, and a guy named Stephen Morgan, who's the Chief Medical Information Officer for a clinic in the state of Virginia, said that virtual visits with clinic health providers increased from about 100 a month before the pandemic to about 800 a day. That's exponential within 2 weeks after the pandemic hit. So it's an idea whose time has arrived, and it is something that everybody wants to see more of.
Absolutely. And especially for those kind of things that maybe not physical ailments, but mental health issues, anxiety, those sorts of things, where you can get to talk to somebody immediately and not have to wait till your condition worsens.
Luis Alvarez, CEO of the Alvarez Technology Group, has been our guest on Power Power Talk this morning, kicking off the Experts program. Online, it's AlvarezTG.com, at AlvarezTG. That's the Twitter handle. And Louis, the toll-free number for the I-Team.
Give us a call at 866-78-I-TEAM. That's 866-784-8326.